Hello, my name is Caroline Murray and I'm a Health Promotion and Improvement Officer in Health and Wellbeing Division of Community Healthcare West. October is Women's Health Awareness Month, and as part of this awareness, we are going to look at women's health across the life cycle. In this podcast, we will be discussing the main health issues for women in their 20s and 30s. I'm delighted to be joined by Dr. Lorraine Mulkerrins, who is a GP based in Gort, County Galway. Thank you, Lorraine, for joining me to discuss women's health for this particular age group.
You're very welcome. It's lovely to be here.
Lorraine, when women in their 20s and 30s come to see you in your practice, what are some of the main reasons for their visit?
First of all, you'll have different types of women. You'll have the women that are really organised and they come every 6 months and they get their prescription and they see the doctor. And then you've got the people that wait until there's something wrong or there's some reason for them to come as an emergency, right? So the main thing, if you were asking what do we see women with, it would definitely be related to sexual health and reproductive health. So we would see the people for the routine smears. We would see them for their pill prescriptions, contraceptive advice. We would see them for STD checks more and more. People are much more responsible and it's becoming much more common. So we would see people present with that as their presenting complaint. A lot of the time though, it's that they come back for their 6-month pill prescription and they want to discuss contraception would be the main one. We see women with, we see a lot of mental health issues at the minute, a lot of anxiety, a lot of, pressure really. People can feel like the weight of the world is on top of them at times at this age group, because I think the expectations are massive of what the expectations people put on themselves.
Okay, yeah. Okay, all right, thanks, Lorraine. And we might look at maybe if we start with the reproductive health and those particular issues, and maybe we'll look at those just a little bit, maybe in terms of what advice you give to women around them and, what women come to get supported on and what support a GP can give to them.
Yeah, I suppose it's good that women are much more aware of their options in relation to contraception, that there's lots of options out there. It's important that they come and have a full kind of frank discussion with their GP, because there are a lot of online places that you can go on and get the pill, and it's kind of a one-stop shop and they're not looking at the whole picture. So I suppose if you're coming in for a contraceptive appointment, we will be looking at the whole dynamic of what's going on, your needs, how are your periods, have you got heavy periods? Do we need to put you on something to stop those? What's your lifestyle like? Are you affected by PMS? There's loads of different contraceptions that can definitely help a lot of these symptoms, and it is worth having a discussion with your GP. Also, we would be promoting a lot of safe sex, because, people can often have the perception that they're on the pill, that they're protected, but they can forget about STDs. And like we have seen a massive rise in chlamydia, gonorrhea recently. And I suppose that's another thing that we would be having a chat with when people come in. Also, there's a lot of options for long-term contraceptives that, there's merino coils, there's copper coils, there's implants, loads of options that, we can, if you come into us, we can guide you in the right direction. So I suppose it is important to come in.
Yeah, and there's lots for women to think about in terms of contraception. As you said, it's a lot more than the pill, and sometimes online, Googling, I suppose, information online.
Yeah.
When a GP is the best option really in terms of giving that type of advice.
Yeah, you're looking at the whole picture, and sometimes you might think, well, I'll go on, it's €20 on to get my pill online, and they'll ask you, what was your last blood pressure, and you can put in whatever figure you want, or what weight are you put in whatever figure you want. To put it in context, I've had one 20-year-old with a stroke and 2 lung clots in the last year on young people on a contraceptive pill. So it's just, these risk factors they're there for a reason, and I suppose stuff is regulated for a reason. And again, you could have come into us, and that girl especially the girl with one of the girls with the clot, she was actually 18 and she'd gone on the pill actually for acne. But she just came in, and the only reason I sent her in was she was a bit tachycardic, her heart rate was a bit fast, but she had a big clot sitting, So it is important to take it a little bit seriously, and I suppose make ourselves a bit important that you attend and get seen. And it's a small thing.
Yeah. And you're seeing that, you're seeing people every day of the week, Lorraine, in terms of these types of health related issues, and and you thank goodness in that case that you spotted that for that young lady.
And you'll know the people, you kind of get a relationship. It's nice to have a relationship with someone, because then you know them and you'll kind of pick up if there's something going on or they're not themselves. And, you might delve a bit deeper and they'll say, well, I haven't been feeling great, or I'm not sleeping, and there's something else going on, there's an issue at work. It's just, I suppose, and it's the one place you can go, you can have, it's completely confidential. You can have someone advise you, and you're not going to be judged. And we probably have seen 100 patients in the same position as yourself,
Yeah, exactly. Yeah. And in terms of the other reproductive areas, we'll say, for example, the smear test, what's the advice around that, Lorraine?
Yeah, so the advice, the smear screening in this country starts at 25. The reason being that people under 25 will often have a lot of cell changes that will end up in unnecessary treatment. But I suppose we still have to be aware that under 25, we can still get cervical cancer. It doesn't just start at 25. So you would want to be aware from definitely 20 onwards, if there's a change, or if you have intramenstrual bleeding, or if you have bleeding post-sex, all of these things, just to attend if there is something different. The other thing, I suppose, it was brought to the fore with all the cervical check, really, I suppose, scandal that went on recently, that it's not just a smear, that if there's a new symptom that you attend. So like, you come for your regular smears, it used to be every 3 years, but now they do a HPV test so they check for the HPV virus. So if that's negative, it has gone to every 5 years. But it isn't a free, you can't just say, well, I'm fine now for 5 years. If you get a new symptom, you still need to attend. So that's kind of what I would say to people, to get to know your own body and what's normal for you. And, to attend for your regular checks. You don't need to be at the doctor all the time, but like, if you notice that there's something new going on that's not just lasting one cycle, that's going on cycle after cycle, you need to attend.
Yeah, that's good advice, Lorraine, I think, for everyone, I suppose, of all ages, in terms of presenting to your GP if there's some change in your body that's and I think sometimes what can happen is a change can become the new normal for you, or you know what I mean, and you think this is the way it is, and and it's just to be aware of those changes.
And we would advise that in all aspects, not just reproductive health, in your whole health as a whole. I think there is an awful lot of anxiety about sickness now, and people are worried that they can get sick, and sometimes they perceive every symptom to be something serious. But in general, what we would say, everyone gets diarrhea and everyone gets constipation, but it generally goes away in a couple of days. So our ballpoint would often be, if something is going on for more than 3 weeks, to attend. That's kind of would be my advice. So if you have something that's going on, it's cough not going away, there's diarrhea, you have a pain that's not related to muscular pain that's not going away, to attend. Yes. So that, as you said, that often after 3 weeks seem to be the bench point, that people become used to this, and they say, well, that's my bowel acting up now, but you attend. And that there's no need to be, I do think that we should take a healthy approach to our health and not get too overwhelmed or almost obsessed with our health, that, have an appreciation that our body is dynamic and different things happen every day, and we're going to have a bit of a tingle in our foot and a bit of a pain here and a bit of pain there, but they generally go away.
Yes.
If that makes sense.
Yeah, that's good advice, Lorraine. Yeah, definitely. And in terms of, is there any particular blood tests that women in their 20s or 30s should get routinely, or is there anything for their general health?
In general, unless someone is symptomatic, I don't see a real reason to be going in to get bloods. If you're tired, we'll do a full blood count, check your thyroid. You look at if someone has a family history of something, you might check it. If someone is obese, you might check their cholesterol. But in general, there's not a lot. Most things will show themselves with symptoms, if that makes sense. Yes. So coming in, getting regular blood tests, we would see no reason for it. And we see a lot of people presenting just to get my bloods. And I think people have a false reassurance, if my bloods are fine, I'm fine, if that makes sense.
Yeah.
So bloods should be really directed by someone, by a health professional, that you need these bloods because
Of course, yeah. So really it should be based on some symptom that you're presented with.
Yeah. Now there is a lot of people asking for vitamin D levels at the minute, because a lot of us are vitamin D deficient, but they actually won't even check vitamin D for us in the hospital in Galway. They won't do the assay because what they'll say is that most Irish people in the winter are deficient in vitamin D and we should take a supplement, if that makes, so they won't even do it for us. So it's So, but if you're in general eating a healthy diet, your energy is okay, you're feeling fine, you don't need bloods.
Okay.
Now there is a bit of a trend for people to get their an AMH checked. That's to check their ovarian reserve. It's becoming a little bit more common. We generally wouldn't check it in GP. We would have to refer you to a fertility clinic, but there is a little bit of a tendency for people to ask for that.
Okay, and is that at a certain stage? Would that be more in the 30s? Right, it depends, I suppose, on the woman.
It depends on people's, their level of wanting. Some people want to know everything and want to know exactly, well, my reserve is this. But also these figures are dynamic and they could change completely in the next 5 years. So it's like knowing something now.
Yes, of course.
It might sometimes give you a false sense of security as well.
Okay, yeah. And do you find many women would talk to you as a GP in terms of fertility and that?
We're seeing that people are presenting a lot later, that people are definitely in their 30s, 35, 36. But they'd be very open, and I suppose they certainly would talk about it. But there sometimes can be a bit of false expectation too about people they want to get pregnant, they're pregnant in their first cycle. And it depends on the person completely.
Yes. Yeah.
Whereas we would generally recommend people in their 20s and 30s, you definitely need to be nearly trying for a year before we're going to be referring you anywhere, if that makes sense.
Yeah.
But it's generally 30s, late 30s that we're seeing people. We're not, in general, seeing people in their 20s.
In relation to fertility.
Yes.
Okay. All right. And thanks for that, Lorraine. And you mentioned earlier as well about maybe the worrying levels of anxiety that you're now witnessing on a daily basis. And how do women present with that particular issue, or do they know it's anxiety when they go to, or is it something else and then they realise that that's what's behind it all?
Well, I'd say every GP in our practice would have at least 10 consultations a week where someone arrives in the door and they are exhausted and they are not sleeping and they have, their mind is racing and, work is really difficult, the kids are really difficult, relationships are really difficult, and they have no idea. They want to get their bloods done because they're feeling there must be something wrong. And then you delve a bit deeper and you ask them, well, what time, and they would have slept 4 hours last night and they woke in the middle of the night and their mind is racing. And, they're not able to concentrate on watching a television and they're sitting in front of the television on their phone. They're not even able to concentrate on one task at a time. So you'll see this kind of almost manic, if that makes any sense, almost manic approach to life. And when you sit down and have a chat with them, it's complete anxiety. And it mightn't even be a specific worry. It mightn't be, well, I'm anxious, but they're just overall on this high adrenaline state. And maybe it's come from our expectation that everything should be perfect, if that makes any sense, and our life should be on a kind of a linear road and everything is going along nice and dandy. Yes. Most of the time it isn't. Most of the time there's a bit of chaos going on in everyone's life, and that we almost have to accept that.
Yes, yeah.
And sometimes there's often a hesitancy in people accepting that that's what's wrong. You will end up having to do the bloods and say, well, everything is fine on your bloods.
Okay.
Yeah. But you'll have a chat with them and you'll hear that, they're getting up and they're going to the gym at 6 o'clock in the morning, and then they're going to work, and then they're meeting, then they're going to the hairdresser, and then they're going here, and then they're going there, and then they're cleaning the house, and now it's 11 o'clock at night, and you'll say, well, when did you sit down? If that makes sense. So it's kind of that, more of that picture. So you're getting that type of person. Then you're getting the type we see an awful lot of health anxiety, and I think that's related to social media a lot, because everything is so visible. Before, it seems like everyone is dying of some sort of cancer every 5 minutes of the day online, when that's not, when in fact the majority of people that have cancer that we see survive and are fine, if that makes any sense. You only see the bad stories. So people are so worried, they get a pain and they think, well, I'm definitely This is it.
And it's a vicious circle then, isn't it? It's kind of all feeding into the anxiety and the rushing around, and life has become hectic for people, hasn't it, in terms of, you know, as you said, trying to lead the perfect life, I suppose.
And it's trying to look perfect and perform perfect at work, and, you know, the kind of concept of being good enough has to come back. Just being that manage, you know, that everything is going along fairly all right, that it doesn't have to be, we don't have to be the top person at work, or we don't have to be, you know, look perfect.
It's trying to get that across. And is it advice you'd give those particular ladies that present, or, you know, is it medication at some stages, or does it depend again, Lorraine?
It depends. A lot of the time it's just having a good chat and telling them kind of to, you know, they have to start making themselves a little bit of a priority. And I'd start saying, well, you need to leave down your phone in the evening. I tell people to leave their phone, plug it in the kitchen. If you're watching television, you're watching television. Yeah. I remember some anxiety specialist, I remember them saying to me before, what do you do when you're brushing your teeth? And I said, well, I'm often in the shower, because I'm in such a hurry, and I'm wondering, what am I putting on for dinner this evening? So the point is that I try to advise people to concentrate on the task at hand. So you have to try and be present. That's the first thing. So if you're watching television, you're watching television. You're not on your phone. Does that make sense?
Yeah.
If you're having a chat with your husband, you're having a chat with your husband. So that would be the first, to try and do one task at a time, rather than trying to be multitasking the whole time. To look at their sleep is the next thing, because sleep is so important. If you're not sleeping, you're not able to function at all. So I'd be kind of trying to get people into, you know, reading a book before going to sleep, rather than being on their phone, scrolling on their phone, having a bath, winding down, not trying to go from, you know, watching kind of relaxing stuff on the television, reading relaxing books, those sort of things. We'd get in exercise, but try to get them to do exercise that's relaxing, that it doesn't become, sometimes you'll see anxious people and they're running at 100 miles an hour, because that almost feeds the adrenaline of anxiety. You want them to take a step back and go for a walk, you know, go to Cool Park for an hour, have a walk, you know, to chat to a friend, rather than almost, you know, you'll see a lot of kind of type A personalities thinking they're doing all this exercise to relax, when they're not. They're just feeding. It's becoming a bit more hyper coming out of it, if that makes sense.
Yeah, it's back to the vicious circle again.
You'd be advising a few apps like Calm and Headspace, which are really good for kind of, you know, mindfulness being a buzzword, I suppose, but they do work, and they're short. They're about 10 minutes, which is fits into everyone's day. And the other thing, having realistic expectations. So if you're in work every evening until 6:30, 7 o'clock, and you're supposed to be finished at 5, you need to be having a chat.
Yes,
if that makes sense.
Yeah. And, you know, just to mention as well, and we will add it to the resources with this podcast, but there are some stress control. There's a stress control program that the HSE run, and also Minding Your Wellbeing program. And again, it's very helpful for that, as you said, Lorraine, that type of giving the time to yourself over a set amount of sessions, weeks, and looking at different aspects. And sleep is one of those as well, which is huge. I think everyone worries. You nearly worry about not sleeping, and then you don't sleep as a result. It's nearly it's another one where it is, and it's very annoying when someone says to you, "Well, just go to bed and have 8 hours sleep," but that mightn't be possible. And I will often say to people, if you're not sleeping, get up and read a book. There's no point in lying in bed going, Jesus, I have 4 hours left. But often the time for themselves, I think if you put it to people that it doesn't have to be, you know, these massive stretches of time. Sometimes if I'm having a stressful day, I'll stop and get a coffee and a bar of chocolate in Centra and have 5 minutes. Does that make sense? That you have, and that can be enough. Or if you come in the door and you're stressed from work, to hop down and have a shower, put on a nice pajamas, and you feel a bit better. It doesn't all have to be a big thing. A lot of the things that I think make us feel better and help us are small things. If that makes sense. Small little changes can make a big difference, can't they? And of course, occasionally people do need medication. You know, if I'm at the stage where people aren't able to concentrate on their job or their life, sometimes they do need, and there are excellent medications. SSRIs are excellent, you know, and we'd be very careful with, you know, addictive stuff like sleeping tablets or benzos. But SSRIs are fantastic when they're needed. Okay. And I suppose that's the other thing. You shouldn't feel, you know, I'm a failure if I have to go on one of these medications, because as I say, you've asthma, I treat asthma.
You know,
Yes.
and with anxiety, we treat it and we want to get you better.
Yes, of course. And if people go on these medications, Lorraine, are they for a set amount of time and you see big changes, or how long would they take to work type thing?
I'll always tell people to put a circle in the calendar in a month's time, and you should be feeling better. And in general, I leave people for 6 months, and then I reduce the dose and reduce it gradually. So like if I had someone on 100 milligrams, I'll put them down to 50 for a month, and then I'll try 50 every second day, and we'll see if the mood is slipping.
Yes. Okay.
And you'll kind of know, some people might have a tendency to be anxious, or some people it might be just triggered by a once-off thing and it might never happen again.
Yes. Okay.
And you'd be hoping that people that have an awareness of what, you know, often people that are anxious will be able to know that it's coming on. They'll nearly know, so they need to watch those triggers and take a step back then. If that makes sense.
Yeah, because of course we all get anxious now and again, or in relation to something. So so it's just you as you said, you nearly know when that's when it's happening.
Or Caroline, like you'd know that if you felt a bit overwhelmed, well, I'll take this weekend off now, and I might, head into Cool Park and go for an hour's walk, and I might go for a nice dinner. That's what I mean about kind of being aware of our health, physical and mental, that we're aware when things are slipping a little bit.
Yeah, of course. Yeah. And that all makes a lot of sense. And thanks so much, Lorraine. There's lots of information there for people to digest. And I suppose maybe if we finish with, if you had one piece of advice for women in their 20s and 30s in relation to their health, what would it be?
That I really want people to be aware of their own mind and body,
Yes.
And value their mental health and work on their mental health. And value their downtime, and your downtime is as important as your work time.
Yeah, great.
And also be aware of any changes in your body and any changes that, no matter how small, if they're concerning you, just to pop into your doctor and see. Most of the time it'll be nothing, but if there's something that's not your norm, you should pop into us.
Great. Yeah, that's sound advice. And thanks very much, Lorraine, again for all your words of wisdom in terms of this particular age group. And as I said, we will add useful resources with this podcast as well in terms of the issues that we brought up today. So thanks again, Dr. Lorraine.
Okay. You're very welcome, Caroline.